Hello, Dr. Heath Foster here with Fostering Wellness in Springfield. That is our newest office. I'm glad to be with you. Today we are going to talk a little bit about allergies. We have decided to call this one ACHOO because, as everybody knows, when you've got allergies, that's what you say a lot. So, what we're going to discuss today is how do allergies work. I'm not going to go too in-depth into immunology because Dr. Taryn did a fantastic immune response webinar not too long ago. I'd highly recommend you look it up. It's at fosteringwellness.net /webinars, and it's called Immune. So look that up when you have time. So tonight, what we're going to do is we're going to talk about what is an allergy. Well, if you haven't guessed by now, an allergy is an immune response. That's why I was referencing Dr. Taryn's. And I kind of built on what she did, but left enough that if you decide to go back and look, she's got a lot more to offer. All right, what is an allergy? It is, according to Google, define a damaging immune response by the body to a substance, especially pollen, fur, a particular food, or dust to which it has become hypersensitive. And that is an autoimmune response. That is the body attacking itself, per se, in response to some otherwise innocuous substance. So normally pollen doesn't hurt us. However, in some people, the body has responded to pollen as something dangerous. Same thing with food or fur or dust, any sort of thing that you can have an allergic reaction to. So that is what an allergy is. How does it work? So what is responsible? And I'm going to dive into this just briefly, and we'll come back and touch on this in a little bit later. So what is responsible? There are two major cells in the body that are responsible. One of them is the mast cell that we see here, and this is just kind of a stylized picture of it. The others are basal cells, or basophils. They both produce histamine, which everybody who has allergies has heard that word before, or at least is somewhat familiar with it, because they oftentimes take antihistamines, something to block the histamine reaction in the body. So there you see mast cells, basophils. When the body reacts or encounters one of those allergens, one of those quote-unquote threats, they are paired up with a mast cell. They'll latch on, and then in reaction to that, the mast cell releases histamine. So what does an allergy look like? How do you know if you have an allergy? Well, generally, allergy are brought on or are indicated by some of these things here. Coughing, sneezing, itchiness, rashes, hives, vomiting, all these things, even shock. They can be very, very dangerous at times. Sometimes they're just kind of annoying, like the sneezing and watery eyes. But if you go into shock, anaphylaxis, that is life-threatening. In cases like that where people carry around EpiPens, something that will get the body back under control to deal with something in a more normal way. So what do all these things have in common? All of those different reactions, coughing, sneezing, they all have something in common. And what that thing has one overall term, and it is called inflammation. The body becomes inflamed, and that inflammation in some cases just keeps building to the point where it gets spiraling out of control. And that's, again, where you need those EpiPens or something like that to rein it in kind of a forceful manner. All right, so how does all this fit together? Basophils and mast cells. They release chemicals as a group called cytokines, and one of those cytokines is histamine. That histamine will be kind of spread out from the area that it is released in, and it goes and acts like a roadmap for the immune cells that Dr. Taryn had a chance to talk about in her webinar. So this is a natural process. It's supposed to happen. It is a protective barrier for us to keep harmful things out. And even the inflammation, the coughing, sneezing, watery eyes, runny nose, all these things are meant to be natural, to expel these pathogens, these allergens from our system. So what happens? Well, that histamine and the cytokines, they spread out, forming a roadmap to these immune cells. The immune cell, they also allow for increased blood flow to areas. They allow for more permeable or more kind of holier, I guess, to use an odd word, capillaries or veins, so that the white blood cells, the immune cells, can actually climb out of the veins or the vessels into the soft tissues, into the skin, into whatever our organ is at issue here. Maybe it's the lungs or the trachea, the bronchia. And then from there, they follow the gradient of cytokines, histamine, to the end, to the original point of release. So histamine increases blood flow to an area. We discussed that already. It increases your heart rate, increases blood clots as well, but it also increases permeability of the capillaries for those white blood cells to exit and get to the site of inflammation or site of origination. The blood vessels dilate. That's the increased blood flow. Swelling and inflammation. That's kind of the hallmark of what's going on here. Thins membranes and allows white blood cells to slip through the vessel walls easier. And again, we've kind of covered all that. And they follow this chemical trail to the original release point. So, along with all of this, that's how this happens. What do we do to treat it now? Well, there's a couple of different things that you can do to treat. One would be more of a medication type of thing. In some cases, that's kind of how you have to treat it in case of like anaphylactic shock, where the body just goes into shutdown mode and uncontrollable inflammation. You have to have something that will stop the inflammation dead in its tracks because it is unwarranted inflammation. Antihistamines. That is what a lot of people with, hay fever or pet dander allergies, that's what they take on a regular basis to deal with their, in particular, types of allergies, if it's just small scale inflammation. Avoidance. The first two here are drug therapy. The last several here are more natural remedies, which are what, as a chiropractor, I would like to see more people deal with them this way, as opposed to the first two ways. Avoidance. Obviously, if you know you're allergic to cats, avoid cats. Now, some people who are allergic to cats decide that they want to own a cat, and that is definitely up to them. But it does mean that their body is going to live in a state of increased inflammation all the time. Same thing with dogs or horses or whatever type of pet you decide to have. If you're allergic to it, you're putting yourself more at risk for chronic inflammation. Natural remedies, we're going to talk a little bit about that. And chiropractic, of course, I'm a chiropractor. I'm going to talk to you about how chiropractic can help with this sort of instance. All right. Corticosteroids, this is the steroidal treatment option here. So they're often used with allergy sufferers. What happens is it emulates a hormone that the body naturally produces called cortisol, and it helps to suppress the immune system. Now, it does this to help, in the short term, alleviate some of these symptoms. In the long term, though, chronically, cortisol has very damaging effects on the body, and it is not wise or not advised to take cortisol or any sort of corticosteroid long term. So the side effects include weakened immune system, potentially allowing you to get sick more easily. So if you take these on a regular basis, you may notice that you have the sniffles more often, or you may get the flu a little easier, or all sorts of things may go wrong, skin infections. So it's an option for treatment, but it has its risks. Please be aware of that. And if you are one of those who absolutely needs to have medication intervention or medical intervention for your allergies, then by all means do so under the supervision of your medical doctor. Antihistamines. Again, these should be taken under the supervision of a medical doctor, someone who is trained in pharmaceuticals, pharmacist. Ask your pharmacist if your antihistamine will interact with any of your other medications if you're on them. But these work by going in and blocking the receptor sites for histamine. So let's say that one of your cells has a histamine receptor, if I can get my hand in the right spot here, histamine receptor like this, and histamine can come in and latch on, and it causes the signal to shoot down the receptor into the cell, and that accomplishes whatever that cell is going to do for the immune reaction, whether that is thinning membranes or increasing blood flow or muscle tension, a lot of things that can happen. So histamine receptor, histamine latches on, causes the immune response to go. Let's say, for instance, now you have a histamine receptor and you take an antihistamine. I have random things laying on my kitchen table. Antihistamine comes in, takes up the receptor, so now histamine, it comes in, sees that it's blocked, and it goes somewhere else, possibly just to be detoxed from the body. So that's how an antihistamine works. Now, it has some side effects, such as dry mouth, drowsiness. Everybody who takes antihistamine, one of their big things is that they make you sleepy. Sometimes you can be dizzy. Sometimes they cause moodiness or kind of mood changes, confusion, vision problems, difficulty using the restroom, trouble peeing or not being able to pee. So again, be aware that any sort of medical intervention for allergies, or any sort of medical intervention, period, is going to have side effects. Mostly side effects are bad. All right, so let's talk about the avoidance, and it's pretty simple. If you're allergic to something, do your best to not be around it. Again, if you're allergic to cats, dogs, flowers, then don't own cats, dogs, and don't grow flowers. That's the best way to avoid chronic inflammation in your life in regards to allergies. Natural remedies. So there's a lot of really interesting natural remedies that can be done for allergies. One of the most interesting ones would be local raw honey. Now, the stuff you buy in a store, I want you to be aware, is probably not local, probably not raw. It may say raw, but if they're selling it in a store, my understanding is that it has to be pasteurized to an extent. And anytime you pasteurize it, that's cooking it, which is making it not raw. So, my recommendation, find a local beekeeper. There's beekeepers all over the place. Find a local beekeeper, see what they can do for you about getting some local raw honey. And raw honey will not look like your regular supermarket honey. Supermarket honey is kind of clear and amber, bright amber. Raw honey is more cloudy. It certainly does not look as appetizing because it's not been filtered. There's still a lot of enzymes, a lot of wax perhaps in the honey itself, but all of those things are actually very good for you. What you want to do is just integrate honey as a regular sweetener in your life. So kick sugar out and start sweetening with honey. one of the big things about honey that I didn't know until I started reading this, doing research for this topic, was that while raw honey is very good for you, pasteurized or cooked honey can actually be very bad for you. In some cases, it can be carcinogenic, or it can actually cause cancer. So you want to avoid cooked honey. So that's local raw honey. Apple cider vinegar. And this isn't just any apple cider vinegar. Again, it's probably the stuff you buy in the store has got some benefit to it. But what you want to do is, again, find raw apple cider vinegar, something with the mother still in it. And you'll know if it has mother in it because it's got little dregs in the bottom. Looks a little silty, but that is where all the probiotics, all the enzymes come from, and that's what is really good for you. And again, you take about a teaspoon of it in a glass of water daily. I would not recommend, personal experience, I do things the hard way sometimes, I would not recommend taking apple cider vinegar straight. It does not taste good. It may make you want to throw up. So, apple cider vinegar, also fantastic for a lot of things in the body, one of which is allergy prevention. Fresh veggies in your diet and a rainbow of colors, different coloration and color schemes of vegetables and fruits, each have different sets of chemicals in them. Those colors are usually associated with beneficial nutrients and chemicals. And they're natural chemicals. They're not chemicals that are put on by the farmer who wants to keep pests off or mold off. These are just naturally occurring chemicals in the fruit and vegetables itself. So, fresh veggies, something that is preferably organic, that doesn't have a whole bunch of pesticides or herbicides on it. Something that has been grown in healthy soil where it can get its natural nutrients for itself, so it can produce and provide natural nutrients for you. And finally, probiotics. There is a saying that your immune system starts in the gut, or there's some people estimate that about 80 to 90% of the immune system is in the gut. Makes sense in that most of what we interact with, we eat. Or that's how we interact with things. We take it into our bodies through our mouth, and it goes into our stomach and intestines. And in that regard, we really need to have some sort of control system in our gut to help us not get sick every time we eat. Because, let's face it, food, natural stuff, is crawling with natural stuff. So, a lot of immune stuff in our gut, and we can help feed those immune systems with probiotics. All right. And moving on to chiropractic. Chiropractic is one of those things that is rather counterintuitive. Most people think of chiropractic as back pain and neck pain. However, there is a lot more to it than that. Chiropractic can help to regulate the nervous system. It was not generally accepted before 5 to 10 years ago, I guess. There was a claim made by chiropractors from 100 years ago that chiropractic can help with immune function and keeping a person healthy. A lot of people said that it was crazy and just ridiculous, but the evidence, which was called anecdotal, was that in around 100 years ago, again, 1918, there was a flu epidemic. Many people have heard about it, and a lot of people got sick and died. Turns out that the people who were under chiropractic care didn't die in as great of numbers or great as percentage as those who were under just medical care. So, anecdotally, we were able to say, chiropractors at that time were able to say we can help with immune system. And the medical profession at that time said there's no connection between brain, nervous system, and immune system. And that's how it sat for a long time. Same thing with the polio epidemic. People did not get as sick with polio when they were under chiropractic care, as a general rule. But we have all seen pictures of the medical profession, the medical mindset, polio, where people are just lined up in iron lungs, big metal machines that do their breathing for them because their lungs were paralyzed. And a lot of people died that way too. So, but like I said, a few years ago, there was a study put out that found in mice some immune system or lymphatic tissue directly in the brain that helped clear infections and immune cells through the cerebrospinal fluid, or the water that floats the brain. So, turns out that chiropractors were right, and the nervous system does in fact have a direct tie to the immune system. So that's how chiropractic can help allergies, by regulating or down-regulating the immune system so it's not so hyperactive. And the effect of this generally is better from a younger age on, so that we can impact how the nervous system or the immune system forms. Once the immune system has actually identified allergens inappropriately, it's a lot harder because the body will keep a memory of that and keep that going forward. All right. So prevention, a lot of common sense things here. For prevention, if you really want to rest, give your body a chance to relax. Most of us have got a hyper stressed state in our lives these days, worrying about things like money or housing or car problems or family issues. A lot of things cause stress, and stress is one of those things that releases cortisol, which means long term it's going to have negative effects. Positive mental attitude. You may have heard this if you've been to any of my Life You Save classes. I don't know if the other doctors cover this or not. I have not had a chance to sit in on their Life You Save class, but many years ago they did a study about two different groups of people. Got to remember where my webcam is pointing. One group, well, both groups had very similar health statuses. So whether that be blood pressure, cholesterol, diabetes, all different ranges of things, they looked at the groups this way. One group had a positive outlook, saying, overall, I think I'm pretty healthy. I know what my body has. I know what the tests say, but overall, I think I'm pretty healthy. The other group didn't think they were very healthy. They thought more like, oh, the tests say that I have diabetes, which means I'm really sick. So what they found was that the group that thought they were healthier tended to be healthier and live longer. So there is a lot to say about what goes on up here and how the rest of us functions. Proper nerve supply. We want to make sure that the body has a chance to communicate with the immune organs like the spleen, the thymus, all the lymph nodes in the body, and allow them to function properly. And that is done by chiropractic adjustments. Proper anti-inflammatory diet. Again, you want to eat those fresh fruits and veggies. More veggies than fruits. You don't want to get too much sugar in your body, because sugar will feed inflammation. Exercise. This will help to flush your body, and it will produce hormones like HGH, which is human growth hormone. It's the thing that bodybuilders and athletes try to supplement, and then they get labeled cheaters because it helps keep the body healthy and young. All right. So that is the end of that. Again, we've covered a lot of things here for allergies. It is better, as the old proverb says, an ounce of prevention is better than a pound of cure, because if you can avoid the inflammation, you don't have to worry about getting rid of the inflammation and all the damage that it does. At Fostering Wellness, any one of our 4 offices, we would love to take care of you and help you avoid that inflammation. If you've already got the inflammation, we can help you with that as well, help your body to recover from that. We look forward to seeing you, and thank you for coming to my webinar.